In this laser clinical procedure video, we're going to be removing a fibroma on the tip of the patient's tongue. This patient is a 48-year-old female, no medical considerations. She's had this fibroma for numerous years. It's just sort of irritating once in a while. It gets ulcerated, or she bites into it and it causes a little pain and she'd like it removed. Most general dentists don't like removing fibromas just because they tend to bleed quite a bit when they're removed with a scalpel. So the laser is a great choice for removing a fibroma with virtually no bleeding, some nice healing, and very little discomfort for the patient following the procedure. We also don't have a need for sutures in this procedure, so we're also going to use a continuous mode when we remove this lesion. In this case, we're going to be using about 1 watt continuous power again. Now with fibromas, because they tend to be more fibrous, sometimes you have to raise the power up a little, maybe to 1.2, maybe in extreme cases up to 1.5. But like always, see how the laser interacts with the lesion. We're trying to find a margin here, so we're sort of angling the tip slightly down into the base of the fibroma and going around the outer edge of it. You can see we're getting virtually no bleeding. We're just trying to get a little bit of a margin there. We will have to clean the tip occasionally because we will get a buildup. If we're using continuous, we're putting a little more heat into the lesion, but again, that shouldn't be a problem. So as we go along, we're just short stroking motion. Again, remember your basic concepts of how the laser interacts with the tissue. And if it's interacting properly, just continue to slowly remove the lesion. If you're not getting any kind of tissue removal or cutting, you might have to go back and reinitiate your tip. Maybe your tip wasn't properly initiated. That's usually one of the biggest reasons that we don't have tissue cutting with the laser. Now once again, we put a little tension on that, and you can almost see where the base of that fibroma is separating out from the rest of the tongue, and we're just using a motion to sort of, again, slowly cut away at that. We'll get a little tension on it as we pull along, and here's another shot of it. We're just going to get that last little side where there's some fibers, get that removed, and we'll have this lesion removed. Now, if you are submitting this for biopsy, you let the pathologist know that you did remove it with a diode laser, and you might want to get a little more of a marginal area, so there's a area of view by the pathologist where you're not creating heat from the laser. So here we go, a little tension. You can see how we're going down, and it creates a little bit of a undermined area where that lesion or the base was, and it's all coming out, and there we have removed it. Now there's no bleeding. We're going to wipe that off. There's virtually no charring, and this is going to heal up very, very nicely. It's just going to take a little time. Again, post-op, warm salt water. Tell the patient to avoid maybe crunchy or spicy foods, and maybe over-the-counter meds as needed. Okay, so we've also added a post-op picture from the fibroma removal. This is about 8 days out. As you can see, it's healed up very nicely. Patient reported virtually no discomfort and did use warm salt water rinses twice a day. And it healed nicely with no bleeding and no problems for the patient.